Seven, 6, 5, 4, 3, 2, 1.
Hi, everyone, and welcome to episode 71 of CBD Talk Podcast. Today, we're going to do something a little bit different. We had a guest scheduled, we had a family emergency, so we're going to reschedule that one. And today, we're going to focus on what we want medical professionals to know about the endocannabinoid system and cannabinoids. And to help us out, we have a little bit of a slideshow, a PowerPoint presentation for you. Now, those of you that are listening on iTunes, you won't be able to see this, unfortunately. I will put the link to YouTube, the video, in the show notes, but you don't need to see the slideshow because we'll read everything that's on it anyway, and you're going to have fun listening to me try to pronounce some of these words. So let's go ahead and get started. So we're going to start out with what we want the medical professionals to know about the endocannabinoid system and cannabinoids. Now, this information was derived from the National Institute of Health's PubMed.gov website, the Mayo Clinic, the National Academy of Sciences, Engineering, and Medicine, and other resources. So let's get at it. First one, search results. Endocannabinoid system from the National Institute of Health's PubMed.gov website. So we want people to research. We want medical professionals to research. I understand that they were not taught this in school. A lot of the doctors had graduated from school before the endocannabinoid system was ever even discovered. So I get it. But if you just go into NIH's PubMed.gov, you'll find 4,770 articles, 1,066 images, 65 clinical trials, and 1,882 of those were published within the last 5 years. So this is some good current information, and it'd be helpful if they would kind of upgrade themselves on this. Because here's the thing, like I said, I don't blame them for not knowing. Okay, I don't blame them for not knowing to a point. What I do think that the medical professionals and the veterinarians, so when I say medical professionals, I'm not just talking about human medical, I'm talking about animal medical too, because as we both know, or as we all know, I don't think there's more than one of you out there, as we all know, the endocannabinoid system exists in animals as well. So this is for nurses, this is for doctors, this is for researchers, this is for veterinarians, just anyone in the medical field, CNAs, understand what it is that we're trying to explain to you. And you're going to have to learn it eventually anyway, because it's not going away. But this is just, this is to try to get some education out there. So, the endocannabinoid system is real. This is not something fake. From the PubMed ID number 165-99912. So this is an article in PubMed. 2 cannabinoid receptors, CB1 and CB2, are expressed in mammals, birds, reptiles, and fish. The presence of cannabinoid receptors in invertebrates has been controversial due to conflicting evidence. I get that. We're still studying, we're still learning. There's going to be some conflicting evidence. Okay, we hypothesize that cannabinoid receptors evolved in the last common ancestor of bilaterians, with secondary loss occurring in insects and other clades. I don't know what a clade is. No cannabinoid receptors are expressed in sponges, which probably diverged before the origin of the Eumetozoan ancestor. All right, that's some big words, but I'm going with it. From the Mayo Clinic Proceedings.org. The endocannabinoid system is a distributed network of receptors, signaling molecules and synthetic and degrading enzymes. All right, so that's important. So here they're talking about the network. They're talking about a network of receptors signaling molecules and synthetic and degrading enzymes. So we're not going to get into the enzymes. Actually, I spoke with David Dawson today. We're going to do a whole episode about the enzymes. So more on that to follow. But talking about signaling of molecules, we're talking this, and this is how the whole homeostasis thing comes about, is this network of receptors throughout your body that's signaling each other, that's telling your body, hey, yo, over here, can you send some of that over here? We could use some help here. Your body is supposed to be able to heal itself, and in many places it does. When it doesn't, we need medical help. We need doctors. We need nurses and veterinarians and such. I mean, that's why they're there. But your body primarily should be able to take care of itself. But if these receptors aren't working, if you have an endocannabinoid deficiency, which is stopping these signals from getting from one place to another, your body can't help itself. So right here in the MayoClinicProceedings.org, this is where you'll find some information about the endocannabinoid system, specifically talking about it being a distributed network of receptors signaling molecules. So that's a good thing. Okay, now we go to PubMed article number 187222389, what the endocannabinoid system does. Now there's going to be some big words in here. I'm going to screw them up, just letting you know. So let's go to this. Okay. The endocannabinoid signaling system, and they're referring to it as an ECBSS, is composed of cannabinoid receptors, their endogenous ligands, which is the endocannabinoids, and the enzymes that produce and inactivate these ligands. Neurons, using this signaling system to communicate with each other. Neurons use this signaling system to communicate with each other. This is how the neurons in your body, it's saying, communicates with each other through the endocannabinoid system. Evidence now shows that microglia, I may be mispronouncing that, the macrophages of the brain, also express a functional endocannabinoid system, signaling system. And that activation of CB receptors expressed by activated microglia controls their immune-related functions. Okay, so breaking this down a little bit. Endocannabinoid signaling system, which is composed of the CB1 and CB2 and probably more receptors, so composed of cannabinoid receptors and their ligands, produce and inactivate these ligands. Okay, so here's the second bullet, which is one I love. Neurons use this signaling system to communicate with each other. This is how our neurons all throughout our body talk to each other. This is how we get those messages from one part of the body to the other part of the body. And then it talks about evidence showing that microglia, something in the brain, also express a functional endocannabinoid signaling system, and that activation of the receptors controls their immune-related functions. Hello! Immune-related functions. Oh, geez, like things like, I don't know, fibromyalgia, rheumatoid arthritis. Geez, there's a lot of things that are immune-related, and these receptors are helping to get that information around. So let's keep those receptors happy by getting some CBD in there and some other cannabinoids. Okay, the next one. The efficacy of cannabinoids is real. This is from the National Academies of Sciences, Engineering, and Medicine. There is conclusive or substantial evidence, all right, conclusive and substantial, that cannabis or cannabinoids are effective, 3 bullet points, for the treatment for chronic pain in adults, antiemetics in the treatment of chemotherapy-induced nausea and vomiting, and for improving patient-reported multiple sclerosis spasticity symptoms. Okay, so specific, very specific things that the National Academy of Sciences, Engineering, and Medicine is relaying to us. That conclusive or substantial, like this is not, pie in the sky stuff, that we want people to know that it works for chronic pain in adults, for helping with nausea and vomiting, with chemotherapy, and that people with multiple sclerosis are reporting that their spasticity symptoms have improved by using this. So those are three very specific things, and National Academies of Sciences, Engineering, and Medicine aren't going to fluff over that. Okay, next. Another efficacy of cannabinoids is real slide. From Karger, their Neuroimmunomodulation 2017 section, if you just Google that, it'll come up with this big long article. and these are excerpts. CB1 is thus important in the development of an efficient innate immune response, whereas CB2 prevents additional inflammatory damage during sepsis. Okay, so this is specifically about sepsis. These studies support the idea that the endocannabinoid system could be used as an effective therapeutic target in sepsis treatment. So, with sepsis, which we all know is pretty prevalent in the hospitals, unfortunately, CB1, remember CB1 is the CB1 receptor mostly interacts with THC, is important in the development of an efficient innate immune response. So it's going to help that immune system with sepsis. Whereas CB2, which works really well with CBD, it's a good receptor for CBD, prevents additional inflammation, additional inflammatory damage to happen during sepsis. So it's helping to stop that inflammation, the spread of the inflammation during sepsis. So that's important. The second one, cannabinoids showing a strong antibacterial activity against the tested methicillin-resistant, I'm thinking this is Strep aureus strains, suggesting that some cannabinoids could be a reliable option for the treatment of antibiotic-resistant, it's capital S, I'm thinking that's Streptococcus, or Strep aureus, A-U-R-E-U-S. So for those that are listening and not watching, I'm sorry, a capital S period A-U-R-E-U-S. Okay. Next we have from Karger, additional stuff from Karger. Yeah, that was a really long article, and they had a lot of good stuff in there. The activation of CB2 could be an alternative in active antiretroviral therapy, as it can attenuate neurocognitive disorders associated with HIV infection by inhibiting viral replication, regulate inflammation by reducing the permeability of the hematoencephalic barrier, and leukocyte infiltration, and suppress the activity of neurotoxic proteins, thereby decreasing neuronal damage. Okay, so like I said, guys, you get to laugh at me a lot today. Okay, basically, saying use CB2, the activation of CB2, the CB2 receptor, can help with neurocognitive disorders associated with HIV. And then it explains how it does it. And suppress the activity of neurotoxic proteins. So HIV, there's some possibilities of working with HIV there. Okay, it is well known that the immune system interacts with the nervous, immune, and endocrine systems. Now considered the neuroimmunoendocrine network. In this sense, endocannabinoid system activation could be considered an important factor in the study of an effective or deficient immune response against infectious diseases. So that's a good thing. It's an important factor in the study of an effective or deficient immune response against infectious diseases. Not bad. Okay. Now, getting to a whole slide talking about studies. Because this is really important, especially to medical people, because you're like, hey, we don't know what the interactions are. You know, how does it work with warfarin? How does it work with, blood thinners? Because that's one thing that people are talking about, that we're finding out about. And how are they finding out about it? By studying it. So here are a list of a few universities that are participating in cannabinoid research. UC San Diego, University of Colorado, CSU, Colorado State University, University of Pittsburgh, Drexel University, Penn State, and Cornell University, and there's a lot more. I just didn't have room to list out 50 different colleges on the slide, but I wanted to get some out there, some good names out there, so that medical professionals can say, "Oh, I've heard of that school." Pennsylvania, by the way, is doing a lot of studies, so they're trying to be in the forefront. Um, Now, we talked about the fact that it's not your fault that you don't know a lot about the endocannabinoid system. Honestly, it was never taught to you. How are you supposed to know? Well, here's how you're supposed to know. So, there are now continuing education units available for your, to fill your requirements that you do every year or whatever it is for your medical license. And these are specifically regarding cannabinoids. And you can get these CEU credits through the Society of Cannabis Clinicians, through medicalcannabis.com, Cannabis Nurse Network, the Medical Cannabis Institute, and also from nurse.com. There are more also available out there, but here's just a handful of ones. The Society of Cannabis Clinicians, they have some pretty big conferences as well. And these things are packed full with researchers, with medical doctors that are already practicing with this in their, in their practices. And there's some great practical knowledge out there. They can start working with you on the list of medications and how it interacts with them. That we are going to be doing an episode on that as well. And so this is why it makes me angry sometimes that medical professionals don't know that much about the endocannabinoid system rather, because you can learn about it. Get your CEUs. Hello. So don't say that there's no information out there, because there is. If you can get a CEU in it, then why wouldn't you? Do one of those. So then we have partnering with your patient. Okay. We've talked about on the show people getting fired by their physicians. If people are using cannabis, a lot of times it's because it's a last-ditch effort. A lot of times it's people who are chronically ill and they're getting worse, and their medication isn't helping them, or the side effects of their medication is worse than the original diagnosis that they have. So and I'm speaking as a daughter of a mother who has been threatened to be fired by her physician. So here's what my plea is for you. First of all, learn about the endocannabinoid system. It's real. I'm sorry you didn't learn about it. There's nothing I can do about that. There is something you can do about it. You can learn about it. Get those CEUs. Talk to other physicians. Talk to researchers. Go to one of these conferences and frickin' learn about it. Please. It's not fake. It is a serious thing. You will be learning about it eventually. They're going to start teaching about it in the schools. It's like years and years and years and years and years ago when it was like, oh, migraines are just headaches. And then they find out later on, oh, it's not just a headache. Be on the forefront, please. Your patients deserve this. Number 2, listen to what your patients are telling you. There's a lot that happens, with patients, and you guys know this. I know that you are up to your eyeballs in charting and computer stuff, and every time you turn around, there's another phone call. But if you could just listen to what they're telling you and listen to how it's helping them, and maybe you will understand why it's so important to them to try. I watch a lot of the Z-Pack, the Z-Dog stuff, and he's awesome. But he's not not on the cannabinoid train, and I get it. We got to get some studies, and I get that, and we will proceed within the normal process of scientific discovery, as we have been, and other countries have been doing as well. But one of the things he talks about is how doctors just don't have the time to really spend time with their patients. And it's because, the insurance companies and the practice and this and that and that, they're shoving all this stuff. You got to do this, you got to do this, you got to see this many people a day, blah, 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 blah. I get it. It's hard. But if you listen to what your patients are telling you, maybe you'll understand why they're doing it. And if you can see how it's helping them, how they have been able to reduce their OxyContin by 90%, maybe you can think, like, even if you think it's just placebo, fine, I don't care. Eventually you'll figure it out, but let's just say it's placebo, okay? But they've reduced their OxyContin by 90%. Isn't that something you'd want to think about? Like, oh, well, okay. If you're reducing your opioids by this much by taking CBD or THC, and we're checking the list of other medicines that you're on, make sure there aren't any problems, any like the blood thinner that I talked about. There's you can Google a list of it. There are some really good articles on that. Then you know what? I'm not with you on this. I don't agree with it, but if you're going to take responsibility about this, this is what we're going to do. We're going to test your blood every week. We're going to see where all your levels are. We're going to see how it's affecting your liver panel. We're going to do this, that, or the other. And if you're going to take responsibility, if this is something you want to do, I will be here. I cannot, I'm telling you up front, documenting it in the record. Everybody's signing it, whatever you have to do. I know I'm obviously pretty freaking naive about what it is, but I know where there's a will, there's a way. I will be here to test the hell out of you and to make sure that everything else is okay. I don't know, guys, we got to get there. We got to get there. As a daughter, we got to get there. Except that anecdotal evidence is due to the lack of studies allowed because of the bureaucracy prior to the passing of the Farm Bill. Yeah, it's anecdotal evidence because we haven't been able to study it. But when you have 10,000 people with the same anecdotal evidence, there's something there. So, okay, it's anecdotal evidence. No, we don't know the dosing. But you know what? Don't let them fucking die while they're waiting for someone to come up with a dosing. Try something. Okay, the last one. Understand that your patient needs you to continue treating them while they try these things. Don't fire your patient. They're trying something. They're trying to improve their health. There's a reason. People who are stable and whose conditions and whose symptoms are being taken care of by medicine, in an acceptable way, to where they're not feeling pain, they're not having the anxiety, they're not having the side effects and all that. They're not going to switch what they're doing if it's working. The people who are using cannabis, and for me, I talk about mostly CBD. The people who are using CBD are doing it because the other stuff is not working as well as they need it to, or they're tired of the side effects. They don't want an increased risk of death because they're taking this pill. They want to try something that's going to help them without all these extra risks of, I don't know, kidney failure. Yeah, that's a fun one. Yeah, take a few, take a few aspirin, or not aspirin, take a few Tylenol, take an 800 milligram of, God, what was it they used to have me on? Naproxen. Just pop a bunch of those. Take some Vicodin, take this, that, the other. They don't want to. They want to try to do something without the side effects. And you know what? CBD is a hell of a lot more expensive than a prescription. So they're not doing it for money. That's for damn sure. You know, you can get a thing of Vicodin for $10. You're going to be paying $70, $80, $90 for CBD. So these people aren't doing it to save money. They're doing it because they're trying to help themselves in a way that's better for their body in their opinion. And help them out, man. Don't fire them. Why don't you just stick around and see how it works? And maybe you can help some other patients at the same time. Okay, final slide. The genie is out of the bottle. Okay, this isn't going away. The endocannabinoid system has been found, it has been documented. We're finding out what it actually does. It's a signaling system in the body. It's not going away. We got to figure out how to use it. You need to figure out by going and getting those CEUs, by studying, going to conferences, talking with your patients, looking at anecdotal evidence, seeing what's working and what's not working. It's not going away. So get on board. Medical cannabis is legal in 33 states as of January 4th. I know it's February already, but I wanted to make sure I had specific things, and laws are changing all the time. Industrial hemp, which is less than 0.3% THC, is federally legal nationwide because of the Farm Bill. Recreational cannabis is legal in 10 states. And here's where it really matters. Money. You know, once money is involved, it ain't going away. The Colorado alone, between January and November of 2018, I know it's February, but I could not find the end of the year sales, but just between January and November of last year, 2018, $1.4 billion. That's one state. California, for the year of 2018, the full year, was $2.5 billion. That's $3.9 billion, two states. And they said that Californians went down a bit. They were actually expecting $3 billion because of the excessive taxes in the state of California. So the thing is, it's not going away. So these are just some things that you can use to talk to your physician about, your veterinarian about. Now they have laws that they have to follow. They can't lose their license. They cannot prescribe this. They cannot recommend it. Can they let you? Can they keep you as a patient? Yes, they can keep you as a patient. Can they say, I don't like this and I'm advising you against it, but I'm still going to treat you? Yes, that they can do. And that's what I'm asking. I'm asking for you to partner with your patients. They're not doing this to spite you. They're trying to help themselves, or they're trying to help their family members. They're at a stage, a lot of them, where they have no other place to go. What they're taking isn't working. And they don't want to feel the pain anymore. They don't want to get hooked on an opiate. They don't want to have the nausea every day with their chemo. They don't want to shake so badly from their spasms that they wake themselves up in the middle of the night and they can't sleep. They can't get a good night's sleep. And the next day they're bitching at their kids and they're yelling at their wife and the world sucks. They want to be able to sleep through the night because it's just important for us to do everything we can, everything that's in our control and even outside of our control sometimes, to try to be the healthy person that we know is inside of us. And if our signaling system isn't working, our body isn't able to help itself. And our body isn't even able to take the medicine that you're giving us and get it to the right place necessarily. So have some fucking compassion for your patients. Learn what you can about the system. Go into PubMed, go into the Mayo, go into Karger, go whatever. Guys, CE fucking U's. Take them. Go to a conference. You get credit for it. You can write that shit off. Hello. Think outside the box. Understand that your patients need you to learn about this. You're going to learn it eventually. So do it now. Okay, guys. We're back to normal next week. If I can grab somebody over the weekend, I'll throw in an extra episode. Next week, I believe we have Celeste Miranda from the CBD Expos. She does them nationwide. Amazing speakers that she brings in. And it's just great information, a great way for people to, like, just people off the street to be able to go into an expo and learn about the endocannabinoid system and see these different companies and what they're coming up with and how CBD is being used. Lots of speakers, tons of speakers at these things, panels, question and answers that you guys can go and participate in and ask every question you want. It's a great resource, and I'm really happy to get her onto the show. Also, we've got Andrew from CBD Lion. He's going to talk to us coming up very shortly on Crohn's disease and how he used CBD to help his Crohn's disease and how that spurred him on to helping other people by creating a wonderful line of products, by the way. And then we've got, we're going to have one on PTSD, specifically on PTSD, CBD, and probably THC as well. I'm not sure, but definitely CBD and CBD and PTSD and how that has really helped improve some lives in amazing ways. So we've got a lot coming up. So stay tuned for new episodes. And until next time, guys. Stay happy and stay healthy. We need you out there.
7, 6, 5, 4, 3, 2, 1.